diet make an impact on the eye health?
Diet these days, if you see, most of them go for the fast food. Yeah. So these days, even the kids, they always prefer fast food like pizzas, burgers. So most of the traditional diet, which was always good, is...
What is the game you usually play while you are driving in the car and you are with your kids? Isn't that I Spy with My Little Eyes? And also this Bollywood songs like Blue Eyes, Hypnotize. And there are a lot many songs in Bollywood which is all related to eyes. The eyes have been associated to beauty. Eyes have been associated to love. Love at first sight. So these are all associated to eyes. And do you think we take care of our eyes properly? I don't think so. So for that, today, to discover so many myths and truths about eye, we have on our show Dr. Basel George. So welcome to my show, Doctor.
Thank you.
So today we'll be talking about eye health, and let's talk about eye health and the awareness which needs to be created amongst the people. So welcome on my show, and I would like to start with a question like how a normal day of a doctor as an eye surgeon looks like.
So when I come to the hospital, there are lots of patients who come with main complaints of watering,
Okay.
of defective vision or less vision, and headache.
Okay.
And they are not able to see properly, or the glasses which they are wearing, it is not perfect enough for them. So these are the main complaints what we come across in our daily OPD.
Okay. So I would also like to know what is the signs and symbols where people should not underestimate the eye health, because sometimes we have a headache and we underestimate that it is just a migraine, or maybe it's just because of the pollution, and it might not relate to migraine, but it might be related to something eye is giving a signal. So how can people make a difference between these symptoms?
Okay, so headache, when a person comes with headache has got innumerable causes. So in that, what eye problem is one of the cause. For example, if a patient or if a person is wearing glasses, but then he's wearing glasses, but then still he's having headache. So one cause may be change in the power of the glasses.
Okay.
Or if a person who is not wearing glasses, but he is not able to see clearly, maybe when he's training or he's giving stress a lot, that can be another cause for the headache. So all these causes can lead to headache. And this is basically seen among people who are always in the working class.
Always in the working. And what is the right age when you should understand that eye needs to be checked by a doctor?
Any age group, people can have eye problems.
Okay.
So starting from the newborns when they are born, it can go up to the elderly who are 80s, 90s. So the area where we have to concentrate more is basically school-going children, because that is the area where people miss. They tend to feel that their vision is good, but then it's only through school screening programs that we come to know that their vision.
Screening program.
Yes. So school screening programs are basically done by eye hospitals, in which they go to particular schools, and in which all the students are being screened for eye testing. And so we check the eye test using the vision charts. And based upon that, we come to know whether they have got good vision or not. And if they don't have good vision, we ask them to come to the hospital for a detailed checkup. And if necessary, we give them glass prescriptions.
So that's a wonderful thing to know that schools are also conducting eye screening. I think like every offices, they do like a mandatory health checkup. I think every school, if they are watching this video, you should also start doing like a screening for eyes for all the children. I think a vision screening should be made mandatory in the school curriculum. What do you say?
Yes, definitely.
And my second question is, like, people these days are like prone to screen. They are not reducing the screen timing. The watch times are going higher. They are watching the screen for longer hours. So is there any particular hours like people should restrict that I should only watch for, say, this many hours is meant, like, good for kids? Is there any hours you say that is good in terms of numbers?
Even if I mention about the hours with which a kid should see, it rarely happens, because if you have a kid, probably to make the child eat, or to have dinner or to have lunch, probably you'll be giving your smartphone. To make the child sleep, you'll have to give their smartphone. So it's usually watching the cartoons these days, children sleep or eat or do anything. So basically, it is a bribe that parents do for the kids by giving them smartphone, which is strongly not recommended. We would always advise the parents to send children to go out and play. Basically, outdoor games are the must things which the kids should have, rather than watching or playing games in the phone or the PlayStation or anything like that.
Okay. So that's good to know. I would also like to know, like, apart from children's, like, what are the other, diseases where you are prone to have, which affects eyes?
Okay, so the eyesight is basically affected by the most common and the lifestyle disease which so many of us have, or which so many of the people in the developing country like India have, is diabetes.
Diabetes.
Yes, diabetes. The eye is one organ that is very highly affected with diabetes if the sugars are not under control. So when the duration of diabetes, if it is long, say for example when it is 10 years or more, when the the control is bad, or when the sugar range is very high, these are the three conditions which cause diabetic retinopathy. The diabetic retinopathy is basically the diabetes which affects the retina of the eye. It is called diabetic retinopathy. So that is very common in a developing country like India. Okay. And hypercholesterolemia. These are the three dreaded diseases which can affect the eyes. Diabetes, for of course, yes.
Does cholesterol affect eyes as well? Because
Yes.
I thought it just affects liver, kidney, and heart.
No, just like it affects the heart, whereas the blood vessels, it gets clogged because of the cholesterol deposits. The same thing happens for the eyes also. Okay. The blood vessels to the eyes also gets affected, and it can lead to even block in that area. So that will lead to a defective vision or the drop in vision. And another condition is diabetes. So diabetes, what happens is initial stages,
So I would like to ask a question, because people, I think we are confused as a normal common people, that we don't understand when we should go our numbers checked for our glasses, or when should we go for a proper eye checkup. Like, how do we differentiate what is a problem and where should we go for seeking help?
Yeah. So when a person who is not able to see clearly has that problem, it is always better to visit an eye hospital rather than going to an optical shop. Okay. Like so many optical shops are there. I'm not naming any of them, but then it's always better to go to an eye hospital and see an eye doctor, because we have to find out what is the cause. Okay. Like there are numerous causes why their vision is low. So we have to find if it is due to a change in power or if there is any other pathology inside the eye, so that we can give treatment.
Okay. So can there be cases like there can be like a temporary, a situation, maybe a firecracker or something, which has led to some problem in the eyes, and it might not be a requirement where you require actually a glasses?
Obviously, firecracker injuries are very common, which we come across, especially during the Diwali time. The seen basically in the kids. So when they don't take proper precautions, we have seen that, and it can be even aggressive injuries, like even very grave injuries in which people have even lost their eyes because of firecracker injury.
Yes. Okay, so be careful when next time you use a firecracker. So I think it was wonderful to know that children has to take care of their eyes, start from the school, and then the mid-age working group area. Children working age is already affected by eyes. Is there any exercise or something which we can do to prevent, to take better health care of the eyes?
The better healthcare of the eyes, if you say for the IT crowd, I would always suggest it is a 20-20-20 rule.
20-20-20.
Yes, okay. The 20-20-20 rule is take break every 20 minutes.
Okay.
For 20 seconds.
For 20 seconds.
Yes, and look at an object which is 20 feet away.
Okay. So guys, you need to remember 20-20-20 rules. So you have to take a break every 20 minutes for 20 seconds, and you need to make sure that you watch an object 20 feet away from you. Thank you so much for that, note. We'll take a note of that. And also, I'd like to know what are the kind of technological change which has come to the industry, because AI has come up, and the devices and the technology is getting enhanced. So what are the major changes which is taking place in the field of ophthalmology?
So ophthalmology is one department in which technology has advanced a lot. For example, if you see for the teens, when they're wearing glasses, so once they do want to get rid of the glasses, so when the power is stable, say by about 20 years of age, if the power is stable, then they can go ahead with the refractive surgery or the LASIK surgery.
Refractive surgery.
Yes, or the LASIK surgery, in which they don't have to wear glasses at all. And the second advances would be like the cataract surgery. So these days now, cataract surgery is done. We have different types of lenses. So earlier it used to be the lens in which you keep inside the eye. So basically, cataract surgery is you remove the cataractus lens. The normal lens, it becomes cataractus or opaque. So you remove that lens and you keep another lens inside the eye. So that is basically cataract surgery. So when you put a lens inside the eye, earlier days they used to see the distant objects very clearly, but for the near vision they had to wear glasses. But nowadays, multifocal or bifocal, there are several type of lenses that have come in which they don't have to wear glasses at all.
So yeah, that's what I heard, and I was curious to know how is that possible. Like at the age of 60, where I think people will be more prone to glasses, and after having a cataract surgery done, they actually completely stop wearing glasses. So that was something very curious. I was curious to know.
Yeah, so people, when they have power, when they are wearing glasses, so after cataract surgery, what we do is based upon the power of the lens, we keep that lens inside the eye.
And does that power does not change at that after a certain
The
age?
power does not change if the person doesn't have any other diseases like diabetes or hypertension or any other. The power more or less will be constant.
And how true is that? Like if people has undergone one cataract surgery once in lifetime, do you think that it reoccurs in the future?
No. Cataract doesn't reoccur because we are removing the lens and we are placing another lens. So that lens never becomes cataractus. Okay. That is a permanent lens. And so we always advise if a person is choosing, say, a multifocal or the trifocal, like I said, those are a bit expensive lenses in which you don't have to wear glasses at all. Like it is so comfortable for seeing the faraway objects as well as for reading. So when a person puts that kind of lens in one eye, it is always advisable to put the same kind in the other eye.
In the other eye, okay. So it is so good to know that people doesn't have to wear glasses after such age. So diet make an impact on the eye health.
Diet these days, if you see, most of them go for the fast food. Yeah. So these days, even the kids, they always prefer fast food like pizzas, burgers. So most of the traditional diet, which was always good, is being affected. So these days, we always recommended people to have lots of green leafy vegetables. Mm-hmm. So these are always good for the eyes and is always give a good preservation of the vision. How true is that people say that you should drink a glass of amla juice, and then amla juice is it's good for eyes and good for hair. The power can also get lowered if you drink amla juice. Do you think it is true? Like for example, the amla juice, or if you see carrot or green leafy vegetables, they are always rich in all these vitamins and beta carotenoids. So it's always good for the eyes, such kind of diet. Okay. So do you think is it possible that people, if they, like suppose if I have started wearing a glass and my number is not too high, it is 0.25 and 1 or something at a lower side, do you think just taking care of my eyes, reducing the screen time or eating some healthy diet can also reduce my power and I can get rid of the eyeglasses? So one myth usually what people have is they always tend not to wear glasses because they feel once they start wearing glasses, they become dependent on it. Yeah, I think that's a common thing I've heard when I was in a teenage. Yeah. I think people used to say, if I start wearing it, I will have to wear it throughout my life. It's better I just wear it like when I'm working or when I'm reading. Most of the time they don't wear. So how true is that? Yeah. So for example, for those people, they won't be able to see. For example, why do you wear glasses? It is because you can't see properly. Yeah. So when you wear glasses, you kind of see clearly. Yeah. So when you are seeing clearly, your body or your brain tends to work less or doesn't have to strain a lot. Mm-hmm. But when you are not wearing glasses, you will have to strain a lot. So when you strain a lot, this power, which was say 0.5 or minus 0.25, it tends to jump. It tends to jump to a higher side. Yeah. So this 0.5 will become about 1 or 1.5 in few months time. So it's always better that you start wearing glasses so that you don't have to, the power won't increase too much. And usually for the kids, when they cross 20 years, then you can get rid of the glasses by doing refractive surgeries like LASIK. Is it true that after 20 years or certain age, the power gets consistent? Yes, in 95% of the cases, it gets consistent. What is the age for, is it different for boys and girls? Yeah, usually for the girls, it stops by about 18 to 20 years. And for the guys, about 22 to 25 years, the power becomes stable. It's just like the girls, they stop growing at the age of 18. The same thing with the eyes too. Yeah. And then it remains consistent up to what age? It remains consistent up to 40 years. Up to 40 years. Yes, whether it's for a boy or a girl. Because after 40 years, you tend to have the reading problem, for which you will have to wear reading glasses. Okay, reading glasses. So I think we have already talked about children's eye care and how we should go for eye screening for children and we should get note of it. But suppose if someone is healthy throughout the life, they don't have any problem with the eye, screen time is low, then what is the actual age when you should start seeing
suppose the eye checkup has to be done regular, and what is the interval and what is the age when we should start?
See, suppose someone is 40 years of age, they come to us saying that they are not able to see clearly the small letters, or they are having difficulty reading the newspapers. So we ask them to wear glasses only while reading. So that is the reading glasses what we give. And usually we ask them to come for review every year. If they don't have any other systemic diseases like diabetes or hypertension or any other causes. So, my dear audience, I would like you all to note it down that as it is said that we should meet the dentist twice a year, we should also go to an eye surgeon for an eye checkup once in a year. You should also go for an eye checkup once in a year because eye health is also equally important like any other organ in your body.